Today on World Heart Day, we have with us renowned Indian cardiovascular surgeon, Dr. Naresh Trehan. Welcome to the show, Dr. Trehan. How is the pandemic treating you?
Well, good so far. Thank you for inviting me and this opportunity on World Heart Day to exchange some thoughts with you and your audience, because this year it has taken a totally different dimension.
Yeah. So, doctor, I would like to know this relationship between comorbidity and COVID-19 and the confusion revolving around it. Tell us viewers, we don't know too much about it. What is it all about and how it can relate?
Well, you know what, first of all, the fact that this is very, very unknown virus that has actually created such a lot of sort of worked havoc, you can say, on this world, and not only one single country, the whole world.
Yeah.
So when we are dealing with a situation like this, when we know that there is a very virulent virus, means that it has a very strong spreading tendency. So when we say RO3, means that if one person gets it, they'll spread it to 3, and then 3 will go to 9, and 9 will go to 27. So it spreads very fast. So that's why what we are saying is that one is the virulence of the virus, COVID-19. The other is the fact pre-existing diseases. So what we have discovered, because there was a lot of confusion at the very beginning of when we first experienced COVID in the world, and even when it came to India, we really did not know what it meant. So what it meant was that first we thought that, of course, it's a virus which infects, it goes to the lungs, it destroys the lungs, and some people who may have pre-existing problems like lung disease, heart disease, hypertension, diabetes, they become victims to a much higher degree than young people who have strong immunity. But that enough damage would be done to the lungs so that the oxygen would not exchange and people would die. That was the first impression the world had. Then, thanks to the 50 autopsies done by doctors in Bergamo, Italy, where they described the whole syndrome in a much different fashion than what we thought in the initial stages. And that made the pathophysiology of the attack by the virus very clear. That means, one, the virus enters your body, multiplies, which we call the viral load. The viral load then gets to your lungs first, does whatever damage it's doing. Then it can go to other organs also, like the heart, the kidneys, the liver, and the brain. And then when it's in the lungs, and the number of virus is overwhelming the body, then the body has what we call the cytokine response. That the immune response of the body gets intensifies to a level that you get a cytokine storm. And it is that cytokine storm which not only tries to reduce the viral load to kill the virus, it also produces huge amount of inflammation in the body. And it is the inflammation of the small arteries that go to the lungs and rest of the body, that when the wall of the artery or arterioles get inflamed, then the blood inside them clots and there is no exchange of oxygen, and that's how people die. Now, once that was clarified, we now knew that what is the mechanism in which it attacks people who have comorbidities. So, back to your question, the comorbidities meant that you have a pre-existing kidney problem. Your marginal kidney function and your kidneys get inflamed from this cytokine, and some of the arteries get blocked, or the renal parenchyma dies, then it throws you over into florid renal failure. Similarly with the heart. The heart already has suffered damage, whether from previous heart attack or from cardiomyopathy. You get more inflammation, more arteries get clogged, the more heart attacks occurs, the more weakness in the heart happens, and then you can die from that. So that's why your pre-existing condition makes you more vulnerable to further damage and death, basically. So then when we realized all this, fortunately, in the meantime, antiviral drugs were repurposed to fight against COVID-19. So we have now the oral medicine favipiravir, which is okay, it's not most effective, but quite effective in the very early mild stages. Then we have remdesivir, which is an intravenous drug, which is more effective and given in time has shown very good results. The third thing is that we understood that when this inflammation takes place, the best drug to use is cortisone, that's dexamethasone, or there are some new drugs like toci and all that which are being experimented upon. So you can reduce the inflammation and avoid that storm and save a person's life. Then of course you have heard of plasma and all that too. Plasma has antibodies. If it is given in time, those antibodies, if they are active enough, they can kill the virus. So to reduce the viral load on the body. Then if in spite of all that, if your lungs get affected and your oxygenation is not complete, you get high doses of oxygen, then some of them will have to go on ventilator, and over 50% of the people who go on ventilator will probably never come off. So that's the lay of the land, which means that those people who have either diabetes or kidney disease, heart disease, liver disease, or any strokes before, they have to be more careful that they protect themselves from this virus, because their vulnerability is much more, and the death rate in these people is much 3 to 4 times higher than people who are young and healthy.
And I just want to know about those with autoimmune diseases, how, like lupus for that matter.
On autoimmune disease, they are on suppressants and already being treated. Similarly, in cancer, they are on cancer drugs which also reduce your immunity. So both the times your immunity is already reduced, that means the virus, if it attacks you, it'll go rampant inside your body without your body reacting appropriately, because you're immune suppressed. So that's why people with autoimmune disease, people with cancer should be very careful. Again, people who have had transplants, same thing. We suppress their immune system artificially because they've had a transplant, and to suppress their rejection, we use these drugs. And that also puts them at a high risk.
And those with pacemakers?
Well, pacemakers, not necessarily, but why? For what reason is the pacemaker there? The pacemaker is there because of the fact that if the heart is very weak already and it is there to stimulate it, then of course they're at high risk. If the pacemaker is there because the heart slows down and just to pick up the rhythm, but the heart muscle is still intact and everything, then the risk is not that much. So it all varies with the degree of disease that you have pre-existing and combination of things. Because you see, diabetes and heart disease are frequently together.
Yeah.
Diabetes and kidney failure are together. So there are many factors which are playing a role. So any risk factor, please be doubly careful. That's all.
And after you recover, even if you're recovering from COVID, is there any chance that even if you've not been a heart patient, it can get affected?
Yes, definitely. As I explained to you, that inflammation takes place depending on the degree of infection that you get. So if you are getting a high viral load and the body's response is pretty intense, then that inflammation can damage the heart muscle and the rest of the organs also. So the heart, the myocardium, the heart muscle fibers, they get inflamed. In fact, today I just did an MRI on a person who is now 3 months post-COVID. He was getting high heart rate. We just did an MRI on him, and it is showing some degree of swelling of the heart muscle fibers. That means he got inflammation. Even 3 months later, he has it. And then we'll advise him not to do strenuous work right now, to be careful. And that over a period of time, he will recover. But if your heart is already weak and then you get inflammation, then there will be a different situation.
Okay. And in terms of treatment in India, as compared to the world, where are we standing? What is the stage when it comes to heart patients and COVID and heart patients just singularly?
So the treatment for heart patients already was as good or better than anybody in the world. If you look at what the results we published of heart surgery, stenting and other procedures, they are better than what the best institutions in the world are reporting. So I think cardiac care in India is at par or better than anywhere. That's why people are coming from all over the world, including the United States, to India. So in my own lifetime, when I was in the US, people used to come from India to New York for me to do bypass. Now from New York, they're coming here for bypass. So it'll just give you the endorsement of the quality of care in India. Now COVID, of course, it's a learning experience on a daily basis, and we have to learn the new say now the new medications that are coming out or vaccines. Now we have to concentrate on vaccines. So it's a continuous process. But what I must tell you, that the world is well connected today. The ability of the Indian physician is well established around the world. So our doctors are as intelligent, or I think more intelligent than most doctors in the world. So they pick up everything that is information that's coming. And fortunately, the medicines are also available in India. So like remdesivir became available. It was started in America by an American company. They gave license to Indian companies to manufacture. So all this is happening as we speak. That the knowledge and the pharmaceuticals and the treatment modalities are moving real time around the world, which is a good thing. Like India manufactured remdesivir, which is their antiviral drug. We have supplied it to 137 countries from India. I mean, it's a good feeling to know that India is at par with the rest of the world as far as healthcare is concerned. The only thing is that there are some experimental new biotechnology stuff that is coming out of the labs, which doesn't happen in India yet. But, you know, it is beginning to happen here also. Our biotechnology firms, our pharmaceutical companies are actually also jumping on the new technology, which is a good thing. So in short periods of time, I think that deficiency will also be completed in India.
And in the rural areas, what is the situation like? Because anybody can have heart ailment, and anybody can have a heart attack. It's nothing to do with the urban-rural bit. But what is the treatment like? How much help can they get?
That's a very good question and a sensitive question, because as much as we can show off at the highest end of care that is available in India, that we are quite wanton at the base level. Now, this new scheme which the Prime Minister announced, this Ayushman Bharat, which means that it is a stack that is to be built from the wellness center to the primary health center to the secondary health center, the district hospital and the tertiary hospitals. So this is a chain which is to be established over a period of time, which hopefully will happen in the next 2-3 years. That what we need today on the ground is, one, prevention of disease, second, early detection of disease. Because today what happens is, because if you can't access any facility early in the disease, then you get sicker and sicker, and then you panic and run to the highest center. So it creates a lot of chaos in the system. So you will see that all the tertiary care facilities, especially the government ones, get overcrowded.
Yeah, exactly.
But that does not necessarily mean that people really need that kind of treatment. But they couldn't figure it out, or they couldn't find it on the way, so they land up in these places. So once this stack is built, where we have some sort of order, starting with the ASHA worker, health worker from the village, to the wellness center, to the being referred up the chain to the appropriate center. I'm hoping in the next 5 years, India can be proud of its healthcare system, even on at the rural and ground level. So I'm hoping.
But then one is a private hospital treatment and one is a government hospital treatment. But how cautious are they towards heart patients? Like how much facilities do they have when it comes to treating people?
Well, you know, what is India's biggest challenge is the population, the size of the population. And so there are very good facilities in the government, but then they're not everywhere. There are very good facilities in the private sector, but they are not everywhere because they are concentrated in A cities basically, in the metros, or maybe B cities now. So a huge system is to be built out. So we have shortage of doctors, we have shortage of experts, we have shortage of equipment, but we need to, what is good, what I told you earlier was that there seems to be a determination in India to become self-sufficient, manufacture everything. There is a new enthusiasm. So if this happens, so there are two things happening. One is the COVID-19, then the other is the Chinese misbehaving. So they have misbehaved both ways. The Chinese, I believe, are responsible for this virus, and they have worked havoc wreaked havoc on the world, and the world should react violently to that. And we should all become self-dependent and get rid of this whole dependence on unreliable people. But I'm saying that is by itself, that double kick of COVID and China's betrayal has actually put a new fire in our tail. At least that's what I feel. You can report from your end. The young people should be even more enthused, even more than I am, that look, we will take India to the next level. And it's time we did, because there's nothing to stop us. We have the brains, we have the facilities, we have the determination of the government to try to get things done. Yeah, once we get past this COVID, I think there'll be a new world. Hopefully.
And what do you suggest, the diet and the precautionary measures with so many immunity boosters flooding the market? What do you suggest, especially for COVID as well as heart patients? Does it really work?
So I'll tell you what really works is exercise and muscle. So if you have muscle and you can exercise it, that's the best immunity of your body. Now we believe vitamin C, zinc, D3, all these things that we talk about may be helping. There's no proof, but it doesn't hurt. So at least it gives you mentally that feeling that now I'm strong and I can face the virus. Not that it should make you feel that you can invite the virus, but you say, okay, I feel like supposing I get it, I can fight it. That mental satisfaction is good. But you know, there are the old grandmother recipes of tulsi leaves and giloi, and then Ramdev adds his own thing to it. So there are many, many things. But one thing is that I don't think any of those things really hurts. So if it gives you some sense of security, why not? But otherwise, good diet means good protein diet, exercise, and the more important thing which we ignore is mental health. People are depressed, they are anxious. You know, it's such a burden. They don't know what their economic condition is going to be. We don't know when it's going to come. And they are worried about their safety, their parents' safety. So there is a whole lot of... So you need to deal with your mental state also. And the best thing to do for that is pranayam of yoga. And yoga today has a special dispensation right now, because of the fact that you can do it in a small space. You can do 30 Surya Namaskars and still be getting the full exercise. Your muscles would be exercised. You'll get your immunity. So many things you can do at home, even if you're locked up, that you can keep yourself healthy. Then, of course, entertainment, but don't become a couch potato. Do not sit there and watch TV all day. That is the worst thing you can do to yourself. So please, keep mobile, do housework, play with children, grandchildren, whatever you have, watch movies, but not continuously sitting on on a sofa for hours and just looking at news, you know, that's something that is detrimental to you, will expose you to more infection.
And another thing, there's a lot of scams on medical. I would not like to specify, but then they're like, if you don't need a surgery, the people are doing a surgery. If you don't need a bypass surgery, again, the stent and everything, all these. So how are Indian medical experts honest regarding this? This is a huge, huge thing.
So, you know, by and large, I think most specialists are honest, but, you know, honest means that people come out of the same society.
Yeah.
So if you look at the value system, the integrity of your surroundings, I'm sure it infects some doctors more than others. But most doctors, by and large, by their training and their mental thinking of helping people and all that, are pretty honest. I don't think that there are many people indulge in bad practices. But also, you know, it depends. You have to take, you know, it's by reputation basically, as in everything else. Then you have to go by that. And there are institutions which have a good reputation. There are institutions which are like, you know, more commercial. But most important thing is that doctor, money, and the activity they are going to do should have no connection. Yes, a doctor does a good job, money comes on its own. So this is the mantra to remember. Concentrate on being a great doctor. People will break the law down. You don't have to chase money. You don't have to bad things. You don't have to give commissions. You don't have to do anything. Just do good work and take care of your patients with sincerity. That's all. What does a patient want? A patient wants that you are going to use your complete knowledge, do it with sincerity and with respect. You respect the patient also. You cannot be, you think that you are the best in the world and you start mistreating patients or being arrogant, so arrogant that you don't have time for them. That's not a good doctor. A good doctor is who can marry his talent, get the maximum knowledge you can, marry it with your skills, then do it with integrity and treat your patients and their families with respect. Those are the 5 things you need to become a successful doctor.
Thank you so much, Doctor, for your time. It was great talking to you.
All right. All the best. Thank you. And a good hot day.
Thank
Bye.
you.